I'm Frank and Shi. This is The Wave. While robots helping with household chores might seem like out of a television drama, it's now becoming a reality in healthcare. A Thai company has joined forces with a government hospital to introduce robots that provide initial assistance to patients in the lobby of the hospital. Joining me now is the director of Charoenkrung Pracharak Hospital and CEO of Dinsaw, Dr. Charoenkrung Pracharak. Great to have you on the show, both gentlemen. I think first question I have to go to you, the director. Of course, what is your decision process to cooperate with Dinsaw robot? And of course, patients, they walk inside right now in your hospital. It's not talk to the nurse, they talk to the robot. So what's the decision process?
Charoenkrung Hospital vision is do the best, make the better health. Yep. We prioritize the development of medical personnel in terms of expertise and skill. We have improved the hospital environment and utilize the modern medical equipment and innovation to ensure that the patient have delivery the excellent service. So I think robot and robotic system play a role in this outcome. We have implemented the robotic system for more than 3 years in blood testing laboratory by using automated blood testing machine, and we see that we reduce the human error and improve efficiency of blood testing and reporting. And the important is we can reduce workload of the medical technician. So I think Dinsaw robot is the new one that we can introduce to the outpatient department. So we can use the robot to assist registration process and reduce the congestion of queue of the patient.
So according to the CEO, of course, this the most advanced, the OPD automation, the robot, has been implemented in your hospital. So just want to understand, what are the feedback on the ground right now? What are the feedback from the nurses, from the patients, when they really walk into your hospital in the lobby and they use the robot there? What are the feedbacks?
We have implemented this robot for more than 1 month. And I see that the patient, wow, is this the government hospital?
Yes.
Yeah, I think they enjoy to visiting and using the robot. When they use the robot, they can insert ID card in the robot, and it will verify your healthcare entitlement, such as you are health insurance right, or government officer right, or social security right. That's the one that is automated check, and after that, it will check if you have the doctor appointment. They will send, generate the guidance slip to lead them to the examination room. But if you, the new patient, no appointment, it can assist you to symptom screening. Additionally, it can input the blood pressure data, weight, height, body temperature, and heart rate into the hospital information system. So I think many process that you must go to some station, but you can now at this station, single station at the robot. So I think this will decrease the congestion at the registration counter. And I think patients happy to use them because the robot is very enjoy to use it. Yeah.
As what you say, wow, people talk about a government hospital in Thailand with a high technology, as in robot helping, no matter it's nurses, workers, or patients there. One more question I want to ask you about is what the technology inside the robot, or how the function makes you firm to accept, to integrate the robot in your hospital. What do you think about it? What makes you firm with the cooperation with Dinsaw robot?
The company that make the robot come to conversation with hospital what hospital need, and we develop together to improve the software that can use in the hospital.
Right, pretty important there because, of course, the conversation and cooperation to fulfill the needs of the hospital, of no matter it's patients or nurses or doctor, there is very important. Now let's come to of course, the innovator of the robot, Dinsaw robot, and we call it OPD, automation. Very important here is the CEO of Dinsaw, Charoenkrung here. So just want to understand, of course, we already have the phase 1 actually in few hospitals in the central region in Bangkok, but what are the new functions of of your robot here in Charoenkrung Pracharak Hospital, and how does because this time we integrate the AI technology in it, which is very important. So how does the AI transform the robot's capability?
Okay. I would say this hospital implement the most advanced robot in the OPD function. Not only the most advanced in Thailand, but I think in the world, because if you Google, you cannot find anything, such thing in a hospital. Most of the robot in the hospital do some other task, but for the OPD patient services, this is, I think, the most advanced. Based on your question, we put so many AI in a robot, so that's why they can perform such duty. I would highlight some. We have AI for screening and triage. So the patient can tell the symptom to the robot, and the robot will understand the severity of that symptom, and also can combine with multiple symptoms. And the robot will have the AI to predict that, okay, number one, is it urgent? And number two, if it's not urgent, what the appropriate department that the patient should further process to. So then we'll combine not only the symptom, they combine the vital sign that sit behind him, like blood pressure, the oxygen sat, and temperature and all that. And that's combined with the AI, so it's more meaningful for a robot to really help predict. This task normally using the nurse. Of course, the nurse has experience, but it's very difficult to make the experienced nurse as many as you want in a short period of time. That's why this process, the robot not only can make more numbers in a short period of time, but also have an advantage of they keep smarter and smarter when you get more and more big data to the robot. So this is a highlight of the AI that is a crucial part of the OPD. Another AI, for example, like they can see the human. When the human walk past by, he will greeting and invite to use him and to process for the OPD process. That's for some example.
So as what you said, less, of course, AI technology can produce the advanced robot that you have there, and no human error, as in, of course, human makes error.
Yeah, because it's, when imagine in early in the morning in a hospital, especially public hospital, so crowded. I mean, not enough nurse, and of course, more patient is have a risk of human error. You have to note down in the paper. You have to enter in the computer, and that's a big chaotic in the morning. But once you automate it like this, the way we do, it helps a lot to reduce human error, to make it more effective process.
And it saves time too, because normally maybe if we go to the normal hospital, we need to have like 15 minutes before when we do all the check.
Yeah.
But for the AI robot, maybe 5 minutes, and we finish it, and we can go to
And
sleep.
if the patient come like 4 in the morning,
Yeah.
3 in the morning, the robot is working
Still
already.
there. Yeah, 24 hours.
The nurse is not wake up yet.
24/7. Yeah, another issue I want to talk about is the challenges. Of course, this is a long path of road for you to arrive at this point. So just want to understand, what challenge have you seen to develop this robot along the way?
Yeah, so many challenges. First of all, it's a new thing of the whole ecosystem. It's new to the doctor, it's new to the nurse, it's new to the decision maker, it's new to the government, and also it's new to me because I just created. That's why we have to really keep improving it based on observation. Some is related to the regulation, some is the issue of consumer behavior, some even the signage is also important. Nowadays we still have something have to improve because the patient don't understand. They just go right into the blood pressure machine without a starting point with a robot and that kind of thing. So it's a matter of evolution that we have to really tuning based on many factors. That's a big challenge for me.
And you talk about the ecosystem. It's very important because it's not just one hospital incorporating it. It's all the government support, hospital efforts to put the robot in, and of course how the patients, they include those robots in their life when they walk into one hospital.
Sure.
Of course, before we start this interview, I talked to one nurse about it, and she said that actually, at first when the robot came into the hospital, people want to do selfie with it. So it's one of the attracting point there.
Right.
I just talk about the government support there. So of course you have had cooperation with governments on this robot development too. But what more you want to get from the government, and what's the long-term plan?
Before answer your question, actually we discussed about implementing robot quite long before this project happened. But thanks for the BOI and Sahamit Thanggas, which is a donator, they have a campaign to really incentive for the donator with a tax privilege. Okay, if they donate something for the government or the public use. So that's why that's important to allow us to start this project. Otherwise, we will be chasing for the budget. Maybe still cannot start. Thank you so much for that. But to answer your question about the plan, I think the government should be based on competitiveness of the nation. You know, this is the things that is a future product that should be able to export. We should use like a strength of the medical hub, that we have a great doctor, great service, but we lack of technology. Okay. If entrepreneur like me create something like this, they should have big support to really expand it and create ecosystem, not only me, but also some other gadget that can plug into each other and come to the total solution. Okay. I would dream to have some, like Thailand not only have reputation of a medical hub, but also the medical AI technology that came from this country. So that will enrich. That's not a dream. It can be real because we make it real already here to show the government. But if you ask about my ultimate things that I plan is I would love to see the robot can be like village doctor, because no doctor want to work in the remote village like that. It's not enough doctor to do so. So if the robot can perform like screening and triage at the village for the people there, that would be great. That could help structural problem of healthcare system in Thailand, because nowadays it's not quite well equipped in that level, so that patient have like tsunami to the city and long queue in every provinces. So if innovation can help that, I would be happy to see.
Yeah, you talk about the medical hub in Thailand too, as in ASEAN and around the world. Before we start the interview, you talk about maybe we would export your robot to other nations too. Is that programmatic in your mind? And you talk about the breast cancer screener too. Do you want to talk about it a little bit?
Okay.
Yeah, just a little bit.
Maybe I'll
Very
come
quickly.
to propose the director later on this thing. So we also have another R&D in the pipeline, which is quite promising, where using the breath of the patient, you just blow in the bag, and then the robot, my Dinsaw robot AI, another module can detect the cancer based on that smell. Okay. And the accuracy now is up to 90%. We are in the process of FDA would be able to service next year. Right. And the beauty of that is that once it's finished, it's downloadable on the robot that work here. So robot can add more capability by itself.
Right. Thank you for the sharing. I think last question, I have to go to the director before we end this. So, of course, we have the robot for like a month or so, but when I come into this building and this hospital, I understand there's a large number of patients actually come to this very good, high quality government hospital. So do you think right now the Dinsaw robot, the number of Dinsaw robot is enough right now, or do you want more to implement in?
It depends on the donator.
Right.
But I think we have 3 robots.
Yeah.
Currently, we have around 200 hospital visits per day that managed by this robot.
Yeah.
But I think it will increase more. And in the future, maybe we can use, if the donator have give more, we can place this robot in another place to can another building that people or patient can go to another building and use this robot.
Strengthen the presence of the robot, and of course, if there's any other donators to put the robot in the hospital, it would be a very good for the society. I think this is.
I will send this interview to the donator.
Oh, thank you for that. It will make impact for the society, for the healthcare system, and for the innovator entrepreneur like you two. Thank you so much for both gentlemen, the director of Charoenkrung Pracharak Hospital and CEO of Dinsaw, to join me today. ขอบคุณมากครับ More news to come.